Without further ado, please give a round of applause to Misty and Misty. Thanks.
Okay, then I'll just come up here since I'm not on yet. Okay, so for the Joppa Environmental Health Project team, first we have ZR Day. ZR is a first-year doctoral student at the School of Public Health at Texas A&M University, where she is studying environmental health. ZR possesses years of experience as a scientific researcher, as she holds a Bachelor of Science degree in biology from Xavier University of Louisiana, as well as a Master's of Science degree in environmental toxicology from Texas Southern University. ZR intends to utilize her educational background and research experience to bring environmental justice and air pollution mitigation efforts to the residents of Joppa. So can I take this off, because I think it's, all right, thank you. All right, so next we have Dr. Ping Ma. Ping is a professor of health promotion and community health services in the School of Public Health. Her research interest focuses on reducing health disparities and social and environmental determinants of health among vulnerable populations using I'm so sorry, I'm losing my spot because this light is messing me up. Okay, socioeconomic status, physio-social factors, behavioral, neighborhood, environmental factors, and access to health services influence the physical and mental health in underserved populations and communities. She is a lead researcher on the Joppa Environmental Health Project with her colleague, Dr. Natalie Johnson, who was unable to join us today, unfortunately. Next, we have Ms. Cecilia Wagner. She is a member of the project steering committee. She's a retired school teacher from the DISD school system. She's a spiritual leader in her community and has been doing community-based work in Joppa for several years. She is now advocating with us for a healthier environment. And lastly, we have Ms. Pauline Logan. She is retired from the U.S. military. She's a Dallas native who grew up in Joppa. She left for a while, came back in 2004, and now she is a resident leader in Joppa on the health steering committee, the project steering committee. So, thank you. Can you kick us off?
Okay, I see. Who's running the slideshow?
They are running the slideshow in the background.
a clicker on the podium.
Okay, I guess I'll get us started. So again, I'm Ciara Day. I'm a doctoral student at Texas A&M University School of Public Health. And today we're just going to be giving information on the overall project in general, as well as the research methodology that us at Texas A&M are bringing on to the team, as well as we're here about community engagement that's going on within Joppa community. So as you can see here to the left, this is a picture of the Joppa community from an aerial view. You can see that there are different sources of environmental pollutant sources that are within this Joppa community that is contributing to the fact that people in these communities are facing adverse health effects. So they're surrounded by things such as the Union Switch Pacific Yard, the Tamco Asphalt Shingles Factory, as well as the Austin Asphalt Batch Plant, which again contributes to adverse health effects. And so just starting off with the research methodology, so just giving background information on why we decided to pursue a grant or the reason for our proposal to help the Joppa community is, as we know, air pollution is a significant factor that associates with the health of various communities and populations of choice, especially minority communities. And so from just generating background, we found that in 2019, air pollution was ranked as the fourth leading cause of death following high blood pressure, tobacco, and diet. And of that note, particulate matter, otherwise known as PM, has been an influential source to air pollution. So for those who don't know, PM are a mixture of solid and liquid droplets that can be suspended within the air, and they vary based on their size. So there's PM10, PM2.5, and PM1.0. The PM10 consists of things such as dust, pollen, mold, and other allergens. Whereas PM2.5 consists of combustion particles, organic molecules, and things of that nature. And so we're mostly concerned with PM 2.5 because of their small in nature, meaning that they have the ability to penetrate deep into our lungs and cause a variety of different respiratory issues, such as asthma, increased risk of lung cancer, and so on and so forth. So again, this does show that there's a significant need to study particulate matter within these communities. Not only that, across the U.S., non-whites are estimated to have 1.28 times higher of burden of exposure to PM-emitting facilities, whereas the Black population or Black and brown communities, they have had 1.54 times higher PM exposure burden. So again, this just shows the significance of why we need to study particulate matter in communities of color. Not only that, we want to know what are the perceptions of risks that are associated with air pollution within the Joppa community as well. Because as we know, air pollution can also affect things such as mental health and other health factors that can be contributed from PM exposure. And so with the use of this, communities have resulted to utilizing citizen science by taking research essentially into their own hands and creating data so that they can know what exactly is the air quality of their air. And so with this, communities have been utilizing low-cost sensors. These are sensors that are pretty inexpensive, where communities can establish them to receive more information about their air quality. And this is heavily needed due to the fact that environmental regulations as well as environmental air monitors are obsolete within these communities. And so essentially these low-cost sensors can provide more representative and spatial temporal variability in residential locations of primary interest, which is Joppa, which are more suitable for these population-based studies that we are doing. Not only that, a few examples of low-cost sensors that are implemented within this community includes the shared Air Dfw monitors, which is provided to us from UTD, as well as purple air monitors. And so with the shared Air Dfw monitors, they have actually insisted that within the next 12 months, they intend to have over 100 new custom-built air quality monitors throughout the DFW region, including the Joppa community. And essentially, this will be the first network of its kind in Texas, as well as one of the largest in the US. And then with the purple air monitors, they come from a small company from Utah. They were based in 2015. And essentially, these purple air monitors became prominent due to people who lived in California. They wanted to know what was their air quality following wildfire events. And so that's how purple air monitors came into use. And so with both of these low-cost sensors, they provide real-time data for people who would like to have access to their air quality. They're free, easily accessible apps. And so this next picture is just a screenshot of the shared Air Dfw dashboard that, again, everyone could have easily, it can be easily accessed. And as you can see here, there are 3 monitors that were established from the shared Air Dfw, and they actually just placed 2 new monitors within the Joppa community, both on Carbondale Street. And this photo was actually a snapshot that was taken from Thursday afternoon, where you can see that there is a high prevalence of PM exposure, or PM 2.5 to be exact. So you can see that it's pretty high. Not only that, the shared Air Dfw dashboard also provides visual content as well. So this is a graph here that shows where on April 21st, around 2:45 p.m., you can see that the PM 2.5 exposure levels within the Joppa community, specifically on Carbondale, you can see that it's pretty high. So again, this serves as significance as to why we need to conduct studies within the Joppa community to ensure that they can breathe healthy air. And then, again, looking at the low-cost sensors, this is a snapshot of the purple air dashboard. Now, this snapshot was taken a few months ago. But again, you can see how easily accessible it is. It gives you information about PM 2.5 as well as PM 10, including even VOCs, and just different things of that nature. So again, these are tools that we as citizens can utilize to know what is our potential air quality. And so now getting into the research questions, essentially why are we conducting this project within the Joppa community? So first and foremost, we want to know what are the community perceptions of air quality in Joppa, and we will be utilizing a community-based survey to find out these measurements, which Dr. Ma will give us more information about in a few. And then secondly, we want to know, does PM exposure contribute to acute health effects in Joppa residents? And so to measure this factor, we will be utilizing mobile-based journaling as well as airway assessments. And so Dr. Ping will now give us more information about this.
Thank you, Zara, for your introduction. So, before I introduce the surveys, so I just would like to tell our audience, the survey questions not only just come from our scientists, and before we come up to these two questions, because this is a community-based project, we talked to the steering committee members and what exactly our scientists can provide you and what the data you need, for this community. Not only just like, okay, this is my research interest, okay? So, and after we, luckily, our founder, Robert Wood Foundation, give us half the year after we got that awards. They give us half the year, 6 months, six months to ask us to refine our research question. Especially, they want us to use the community-based participant research to engage our community residents and to ask our scientists to go to the community to learn what exactly the community needs. So, based on the community-based engagement, the activities, and also based on the talk between the scientists and also our steering committee members. So we have the two research questions. This is the community needs. Okay. So the first question, we want to know what are the community perceptions of air quality in Joppa. So we want to know, okay, what they think, what our Joppa community residents think, how they feel, how air pollution, the severity of the air pollution in this community, and also we want to know, okay, what's the prevalence of the chronic disease, specifically the air pollution related disease like the asthma. So what's the percentage in the average prevalence rate in this community? And if compared with the rest of Dallas, or either we compared with the rest of Texas, if Joppa communities, the prevalence rate is higher than the rest of Dallas or rest of Texas. So that's why we used our survey, and we developed a community-based survey, and this survey actually we kick off last week, right? Like we had the first kickoff event last Monday. So right now we are just like the data collection is ongoing. The survey, we have the survey includes 5 big sections, and they overall they have 60 questions. And the first section is about the outdoor air pollution in Joppa. And also the second section is the indoor air pollution perception in Joppa, what they think, and if they have if they realize any pollution happened in indoor. And also the third section is about their general health status. So we ask the questions about their currently, what the chronic disease they have, and if their family member also have the similar, and if their family member also have any chronic disease. The fourth section is about respiratory health status. So this is the part that we want to know what's the air pollution related disease happened in this community. The last section is we ask about some demographic information about their age, their gender, and also the race or ethnicity, and also the family education level. And the second research questions, we want to know does PM level exposure contribute to accurate health effects in Joppa residents. So this is also we want to know. Okay, so when the scientists talk to our community residents, and our community residents some residents ask us, okay, now we know we live in a community surrounded by the air pollution, heavy industries, and a lot of people come to our community told us, oh, it may impact your health, but how? they want to see the evidence. They want to see the data. They want to see if there is a relationship or association between their air pollution exposure with their health outcome. So that's why we use two ways to show that there is a connection. The first research project we use self-reported measurements. So this is a cell phone-based journaling method. This method we will hire 50 people with asthma, the pre-existing asthma disease, and we ask the participant to download our mobile app, and we follow up those populations in the every 3 months. So every season, we ask the participant response to the daily assessments. So we need to those participants, each day the app will random pop some assessments, and they ask them, okay, for example, like in the last hours, if you have any asthma symptoms or any other chronic disease symptoms. So the people just report it. And so we collect every season, so every 3 months, every season, we collect the data from those participants for 14 days. And we want to see, and also we use their the symptom data linked to the same day, the air pollution level, and see if there is we will see if the air pollution level, for example, today we see there's an increase, and if their symptoms also increase as well. The second, so this is the first one. So this is a subjective, a self-reported assessment. We also have another objective assessment to show the association. So yeah, and also Sarah will talk about that.
Thanks. So with the second measurement, so we want to conduct a longitudinal panel study looking at 25 healthy children who live in Joppa. And by healthy, we mean they have not been diagnosed with asthma or any type of respiratory issue. And so another factor is that they would have had to live in Joppa for at least 1 year. And so by way of this, we want to evaluate the phenol content in all of these children. And so phenol stands for fractional exhaled nitric oxide. And so essentially it's a gaseous molecule that can be found in the human breath test. So physicians for years have utilized phenol assessments in both adults and children to look to see basically the health of their lungs, to see if they have any type of lung stress that can be exhibited. And so with this, we're going to utilize these phenol assessments to look at the health of children's lungs, and then of course compare it to what is the PM exposure of that day. And so we do plan to conduct this upcoming summer for about 8 weeks, just to start off. And again, once we take the phenol measurement, we will also then compare and look at the low-cost sensors from the shared Air Dfw monitors as well as the purple air monitors to see what is the PM content for that day. And so we do expect to see that if there is a high incidence of PM exposure for 1 day, we will also see in correlation that these children will exhibit some type of active airway inflammation. And so again, that's just another way of how we will look at the health of residents in Joppa as compared to PM exposure. And also by way of how we are working with the community to ensure that they are receiving all the information about our project, we have created a community website where it posts information about everything that's related to our project, as well as background information on what is particulate matter, as well as what are the sources of penal pollution in Joppa as well. So if you all would like to receive more information about our project, please feel free to head to our website. I see some people are taking pictures, so yeah, it's a long link. Not only that, we also just created a Instagram page. So if you are on Instagram, please feel free to follow us where we post daily updates about our project, as well as upcoming activities and so on and so forth. And so now we will turn it over to Missy for the community engagement portion of our project.
Okay, go ahead. Okay. So, community engagement, as Dr. Ma said, was a very big focus of doing this project. We wanted to do it in partnership with, not on top of and draw them in when we need them. We didn't want it to be something that was transactional. So we created the Joppa steering committee to oversee everything that we did with this project. Everything from the survey to outreach events to the wording and emails that may go to local decision makers. Everything that we do goes through the steering committee. No decisions are made unilaterally. These relationships, I would like to say, some of them began, I'd say as early as about 2018, when Downwinders began working in Joppa to get air monitors put up. The city of Dallas was not a partner, so in getting those air monitors put up, we actually had to work with residents. So those monitors that are on Carbondale, the monitors that you saw on the shared Air Dfw map, those are on private property. Those are not on city property. So that was kind of where the engagement started, and those relationships that we built at that point started as the base of our steering committee. And of course, Ms. Pauline came in a little bit later. Ms. Cecilia was one of our original steering committee members. Jabril McDuffie, Tasha Muhammad, I think that's everybody that started. And later on, we had Ms. Pauline come in and Ms. Alicia, and they are not here. They're actually graduating from a course today, so they couldn't be here today either. If you look here, because I pressed the button a little too fast, this is some pictures and a flyer from some of the engagements that we have done. We started engagement last year in April to give people information about the project, what it was, to give them the opportunity to speak with the scientists so they didn't feel as if they were being blindsided. It was an opportunity to interact with what was going on and to ask questions in real time. So since then, I want to say that we've done about 4 community events geared to do outreach, to prepare people for the idea that the survey was coming along, to continue to build the steering committee, because we do want for that central body to be able to inform not only this project, but any other future community work that they're feeling that they want to do. So, yeah. And no successful outreach is done without partners. A lot of partnership has happened. As you see in the picture, Parkland came out. We've done visits out to Joplin with asthma chasers and positive breathing to do respiratory assessments on folks to give them an idea of whether or not they're having respiratory issues. I myself have asthma, and for anybody that does, when your chest is tight, you do not always realize that you are having an asthma attack. And so giving people the opportunity to interact with Parkland and positive breathing to figure out, where exactly do I stand, to know if there was an issue, and, to give them an idea of whether they need to seek further medical care. Oak Cliff Veggie Project, of course, Paul Quinn, and others have been really, really, really good partners in supporting different community outreach and just the project in general. So now I'm going to go ahead and open the floor up for our first steering committee member, Ms. Cecilia. I already gave you her bio, and so I'm gonna go ahead and go up here and let her give you her take on the project and how she feels about it. Get her straight up. You can take it off. There you go.
Good afternoon, everyone. Good afternoon.
Good afternoon.
Thank you. Because it's been a long day already and we've eaten, I thought I'd kind of boost us up a little bit. So, I know you haven't been in school in a while, but for those of you who remember, if I say, give me a J, what do you say?
J.
You got your J, you got your J. That's what you say. Okay, you give it back to me. All right, so we're gonna spell Joppa, because that's where we're from. Give me a J, y'all. You got your J, you got your J. Give me an O, y'all.
You got your O, you got your O.
Give me a P, y'all.
You got your P, you got your P.
Give me a P, y'all.
You got your P, you got your P.
Give me an A, y'all. You got your A, you got your A. Let's spell Joppa. Hey, let's spell Joppa. Hey, let's spell Joppa. Hey, Joppa. Hey, thank you, thank you, thank you. You still got it. You still got it, okay? We haven't been in school a while, but we still got it. And we're here representing Joppa. And the right name is Joppa. But we call it Joppa. And we want justice for Joppa. Because we think it's an injustice that the citizens of Joppa have to breathe in PM 0.5.
PM 2.5.
Okay, there. PM 2.5 and all those others. So we're concerned about the air quality. And I am a retired educator for 38 years. And so I'm quite accustomed to working with parents, teachers, and children. And how many of you are one of those? A parent, a teacher, or have children? Okay, give yourself a hand. And because of my lengthy time working with people, I am a minister of the gospel at the New Zion Missionary Baptist Church, where I get to honor and serve the Lord and work with the people in the community. And so it concerns me when our young people, especially, as well as our adults, are having issues with the air quality. I care. Amen? God cares. Amen? And I hope you care. So why we're here is because we want to find out for sure, is the air quality damaging the health of the citizens in Joppa? That's why we're here. And people ask me, well, do you live in Joppa? Well, no, but I have served there in Joppa since 2004. So how many years would that be?
18.
18 years. Thank you. 18 years. I didn't teach math, by the way. So, because I've been there forever and a day, and I come multiple times working with the children, I've heard stories about how when they come out of their homes, everything's covered with this dust. It's the PM coming out of the air. And I've heard stories about how when they raise their windows, they smell this awful smell that smells like sulfur or something. And I've heard stories about people, how they have trouble breathing at night when they lay down. They have trouble breathing. It concerns me because I know children like to play where? Outside, okay? And some adults too. So because we like to be outside in our communities, it's only fair that our communities have the best quality air possible. So that's what brought me to work on this committee. And life is a cycle because I started my teaching career in West Dallas, where there was a lead contamination going on. And we got through that with the help of all of the government agencies and the federal politicians and what have you. And I think we can get through the situation in Joppa if we take action now, rather than waiting for something bad to happen down the road. So I'm excited about the air monitors coming up, and we're getting good feedback from the air monitors. And then the next question is, what are we gonna do about it? Because it's not just enough to know. That's step one, identify the problem. And then step two, do something about it, eliminate the problem. So I'm hoping and I'm trusting and believing that this is a major step in the right direction to find out, is the air quality damaging the health of the citizens in Joppa? And then what will the city and the citizens in Dallas do about it? So would you join us in our effort to make a difference in Joppa. And now, before I close, the word justice is what we want. And you know, justice is fair. All the other communities in Dallas don't have an industrial strip right next door. So we want fairness. And we want justice, which means fairness. And so, when you think of the word justice, there are other words that we can make from the letters that spell justice. Are you with me? So when we spell justice in our minds, what words can we come up with from the word justice? Well, us, U.S. Those two letters are in justice, right? So this is all about us as citizens. Whether you live in Joppa or not, if you don't get involved, that means you don't care. And we should all care about each other. So I see us in justice. And also, I see just, J-U-S-T, right? Injustice. It is just a matter of time before this thing could get out of hand if we don't do something about it. So I'm hoping that we take action now. I see jet, J-E-T, in the word justice. Do you? So we need to get on the move, okay? And we're on the move already. We're sending people out to survey, and we're jetting around all over the place trying to find out, did you know? Have you heard? Do you feel? We're asking questions. We're getting involved. And I'm hoping that you will take the time, even if you don't live in Joppa, to find out, pay attention to the air monitors, and find out what are your local politicians doing about the injustice in Joppa when it comes to the pollution that the citizens are having to endure. God bless.
She does speaking engagements. I'm her manager if any of y'all want to hire her for one of yours. All right. So next, we're going to go ahead and go to Miss Pauline. You want to come on up and get her feedback? I don't know if you can top what she just did.
I can't.
Okay. You have it.
Hello, everyone. I just want to give my perspective as a resident of Joppa on and off since I was 8, when we moved there with my family. When we moved there was the noise pollution with the train. The shingle manufacturer was there, and we had this huge landfill on the other side of Joppa where all of the trash, all of the garbage was dumped. There was no partition, fence, or anything that prevented people from directly walking into the landfill. Children actually played on the landfill. I was there until 67 when I graduated high school, left, and would come back whenever my husband was in Vietnam. I would come back for a year or two. And eventually he died and I moved back to Dallas. And our son and daughter graduated and got married. So I downsized, came back to Joppa, and lo and behold, there was not any semblance of progress made in the pollution. There was actually more polluters there. In addition to the shingles manufacturer, the asphalt manufacturer was there. The batch plant manufacturer was there also. So it's just very discouraging. It can be discouraging, put it on a positive respect, that Dallas has continued to allow these kind of polluters to do their business in manufacturing right adjacent to our community. Although the land is still pretty, there's still the trees and the parks and the birds. But as a resident, I think that the residents deserve to breathe fresh air, to be able to exercise, ride my bike, walk walk or exercise in the street without the coughing, the congestion, and to be able to just lay down and sleep at night without congestion and difficulty breathing. So this project for me is something that I'm really looking forward to being able to become involved in, and just to see exactly how the residents of Joppa, how our health compares with other residents in the other parts of Dallas. Because it's just so important to me to be able to have the same kind of quality of life in Joppa as a resident that other parts of Dallas residents experience also.
So, there's only a couple of y'all in here, so are there any questions? I think we'll just open it up at this point so we can interact back and forth. Are there any questions about the actual initiative, experiences, or anything of the like? No? Okay. Well, thank y'all for coming. And, yes.
I saw on one of your slides, I don't know if it was for us, but it says join our community of citizen scientists, get your own outdoor SD sensor just like this one.
Okay, so that is actually an initiative under Downwinders at Risk. If you go to our website, there are some classes that are geared to teaching people how to do their own air monitoring. So yes, you can go to our website, Facebook, or just reach out. And that's usually listed online. If it's not, and that's something you're interested in, I can speak with the young lady that's over that, and she'll get back with you. Yeah. Nothing else? Well, thank y'all for showing up, and yeah, if y'all have any questions, definitely go to our website. I'm gonna find the slide that ZR so kindly made with that information on it. Oh, there it goes. And yeah, definitely go to our project website, Downwinders at Risk, and we will definitely get back with you on any inquiries. Thank you.